Welcome to the Immune Edit. I'm Dr. Doug Jones. If your immune system feels like the enemy or you're just tired of not feeling like yourself, this space is for you. Welcome in. I'm so excited for today's episode. I've got a special guest with me. It's Doctor, correct? Dr. Olga Kagan.
Yes.
Why don't you introduce yourself to the audience and just tell us about you.
No, fantastic. Thank you so much for inviting me. Pleasure to meet you. And I am actually a nurse, doctorally prepared. Started my career in 1996 outside of the United States, actually in a infectious disease hospital dealing with TB patients in former
Where?
USSR. Well, it's a
Oh,
former republic of former USSR. So I was born under USSR control, and then by the time I left, it was its own country known as Uzbekistan. As fun fact, we share a short border with Afghanistan, so you could imagine,
yeah,
because USSR was big. So I just kind of put it into perspective so people have an idea where it's at.
sure.
But I did move here in 1996 and went back to school, and proud graduate of Hunter Bellevue School of Nursing, where I got my baccalaureate degree and then pursued my advanced studies at Malloy University, um, majoring in nursing informatics and administration. And then in 2018, I graduated with my doctoral degree. So,
Fantastic. And then what are you, how has your career kind of evolved?
so I had a very interesting journey. I started in a critical care setting, was a cardiothoracic ICU nurse, and worked in a couple of hospitals based in New York City. And then after 9/11, there was a need for a World Trade Center program to help monitor and treat responders who worked at ground zero. And so myself and a handful of other nurses and physicians actually spearheaded a program out of Mount Sinai, the Occupational Environmental Medicine department, called 9/11 World Trade Center Medical Screening Program. And we've built that infrastructure too, that still is running today. And recently they got a funding all the way through 2099, believe it or not. So this was sort of like a baby that we built for those individuals who worked at ground zero. And just so we can monitor, part of the program was actually research so we can monitor them long term to see what some of the upper and lower respiratory conditions, mental health, cancers, etc., that people may have developed from being exposed to the very unusual mixture of environmental pollutants that were in the air at that time. So it was a very rewarding experience, but also the time where I sort of understood the power of data and information, because we collected enormous amounts of data. And to do that back in a day that was early 2000s by hand was just so burdensome and labor intensive. And so we were in process of implementing electronic health record, and kind of sparked my interest in informatics and data and research. And so that's how I ended up actually going back to school to get my advanced studies, because advanced degree, because I wanted to really understand how can we do it better, more efficiently, so we can how have this information and data to get future funding to help those patients. And so we're here today. And then I had in between a couple of maternity leaves with my children, and both of them ended
Hmm.
up developing food allergies. And having worked with people with allergic conditions, environmental primarily, I started getting more into food allergies and understanding the root cause and what what it's like. And my doctoral studies, actually, I really dove more into it and studied individuals' willingness and readiness to act in a food allergic emergency, because I wanted to really understand who are those individuals who we can potentially train to act in those emergencies on the college campus, for example. So the focus was really trying to change policy and make epinephrine accessible to people with food allergies. So, and then of course,
And
well, it evolved into what I'm doing now, but I'm happy to talk more about that.
yeah, go ahead.
So anyhow, while I was, of course, dealing with this and learning more, and I decided that, talking to people and other nurses, we realized that, there was a gap. Given that as nurse, even though I was a nurse, I had very limited knowledge of food allergies. And so we are not taught in our nursing curriculum about food allergies. And I think it's pretty common problem, not just for nursing education, but I think medical education too, because I always know at the Quad IA meetings when we talk, we always talk about how can we reach more pediatricians and other specialties in order to increase their knowledge and education on food allergies, especially now with early introduction and newer guidelines and whatnot. So we experience this similar problem in nursing circles, except we've got over 5 million nurses in the United States, and so how do you educate all of those
Wow.
nurses? How do you make sure that they're allergy competent, and especially if it's not being taught in their nursing curriculum? And that sort of sparked my interest in doing something for that group to make sure that we not only have physicians who are allergy informed and mental health professionals who are allergy informed, but really the nurses who are the largest workforce in healthcare. And that's where my passion lies. And of course, being in the informatics world and technology. So for me, I am really passionate about harnessing technology to maybe develop alternative models of care where we can harness technology to deliver some of that education and also newer roles to help allergists see more patients and reduce that access to care issue. And so that's how Food Allergy Nursing Association was born. It was a small group initially called Food Allergy Nursing Interest Group. Since 2019, it was just a handful of us. And then in 2022, we published an article with our vision for that certified allergy nurse educator role, which would be delivered via tele-nursing, similar to telemedicine. And there was a lot of interest. So people were reaching out and they wanted to be part of this initiative. And so we decided to open up our group to more nurses. And of course, once you've got all those nurses, you feel like something has to be done in a more structured way. And that's how we sort of incorporating and making it into an official nonprofit 501c3 Food Allergy Nursing Association, which is now a global movement. We're now across 5 continents, and our members come from Asia, Australia, Africa, Europe, and of course, primarily here in the United States. So
That's tremendous. How have you been able to manage all the growth?
it's been challenging, but we have to do what we have to do because I think many of us who were those core group and co-founders very passionate about this cause. We actually do have an allergist on our board because we don't believe in working in silos. We want to make sure that we've got people who are working in the same ecosystem because we're part of the team. And so Dr. Alice Hoyt actually is one of our board members, who you probably know. And
Yep.
she's been also a trailblazer, I think, in many ways within the allergy space. And I know she's very passionate about educating school nurses and nurses in general. So we work well together and, doing all we can in attracting interest and support from people who share with, our mission and our vision for better care of families and their, patients and their families.
Yeah, that's amazing. So, what do you have, or how do you educate the nurses? Even across 5 continents, you'll have different, obviously, language materials. There's got to be some kind of continuity, but you're dealing with different healthcare systems, different languages, all kinds of things. Do you hold conferences? Is there online resources, or how have you kind of managed the dissemination of accurate information?
So it's actually interesting you asked that because we are a very new organization. We just turned 1 year old a couple of months in December, actually, as an official nonprofit.
Yeah.
And But primarily we offer all of our offerings online. So we do utilize technology such as Zoom, for example, and we hold monthly speaker series where we invite um, individuals of certain expertise to come and join us, and we offer professional development hours, CEUs, um, for those sessions, and we make them available for up to 9 months for people to view and claim CEs in case they are not able to join us, whether it be conflict with the job responsibilities or maybe time zones, etc. Because, like I said, we do have a wide representation, and we try to also alternate hours. Like in the summer, we try to do afternoon sessions, and then during the year, we try to do evening sessions. So that way, we can accommodate different time zones. And I know you'll be coming and joining us in the summer, I think, right? Or hopefully, my
Yes.
our members can meet you and learn from you as well.
Yeah. Yeah, that'd be great. I'm looking forward to that. Um, that'll be amazing. So, what are currently your top initiatives that you're working on?
All right, so we have a few. uh, Number one, of course, education. So that's number one. We also have
Right.
a number of committees, one of which is a research committee, and also they're working on initiating nurse-led projects, especially trying to identify what the gaps are, so we can do more research and implement evidence into practice. So that's important to us and share best practices. We also are in the process of, we have two of our members who are editing a food allergy book for nurses because for years we haven't been able to find a resource that specifically is for nurses. And so that book is hopefully will be launched this year, and we're already planning for it later in the year. More to come. We also have another initiative that's in the works, which is the Certified Allergy Nurse Educator role, utilizing this technology component. And I know it's been a vision for us and many of us for many years, but that does require a lot of coordination and willing individuals to support, as well as financial funding, which we're in the process of trying to secure in order to pilot the role to see the ROI and how we can help offload some of the responsibilities from physicians, from allergists, in terms of especially nurses really good at education, care coordination, etc., and follow up. So if physicians can offload some of that on those nurses, they can potentially see more patients faster, so they don't have to wait 3 to 8 months to make an appointment to see an allergist. Because we've seen that, and again, I'm in New York. It may not be the same, of course, across the country or across the world, but we do know that allergy is pretty small specialty in medicine, and so we also know that I believe it's Ruchi Gupta's team that did a research study back in 24 where they talked about acceptance of insurance. And I think in New York, it was about 13% of allergists that even took Medicaid, for example. And we have like about 2 million food allergy patients in New York alone. And 3 out of 8 people have Medicaid. So just thinking about access to care is such a big problem. And not only in urban communities, but also rural communities, where patients have to travel sometimes for hours to see an allergist. And so there are real challenges out there. And as nurses, if we can help alleviate some of the burden on the patient and the physician and be that bridge or conduit to care, we want to be able to do that.
Yeah, that's tremendous. It kind of aligns a lot with some of the things that I do in my practice because we have developed a hybrid clinic where I'll see patients in person, but we also have a large telehealth component because of the need that you were talking about, where so many patients may live in a rural community, not have access to a doc, have to travel, hours upon hours, which, especially with a food allergy patient, travel in and of itself is stressful and expensive.
Yep. Yep.
And so we kind of found it or thought it important to be able to eliminate some of those barriers and some of those challenges, because if you have somebody that doesn't have access, but yet the only way to get access is to travel and have the added expense and stress of that, that's a big deal. So we wanted to be able to cross some of those bridges or builds bridges into them, and trying to get them better access to expert care without that burden, really.
Yeah.
So,
And what also I
um,
noticed that many of those patients sometimes bypass the care because they have to take time off work to travel. They lose income. There's just so
Exactly.
many different we call them social determinants of health, right? So just
Right.
kind of it's so multifaceted. There's so many different barriers, and it's hard to reach. And I know some of the individuals would just not go and just take a chance and risk
Right.
it, and that's dangerous.
Exactly. They you're exactly right. A lot of them will just go without the care. And one of the things that was really interesting, like when COVID hit, for instance, is kind of a little story, is it when COVID hit and we were struggling with not being able to have patients even come to clinic, it was interesting because government and insurance all of a sudden said you can have all this access to telehealth,
Yeah,
and which was fantastic. We were getting proper reimbursement. We were able to really expand the care. And I was doing some work with one of the allergy asthma groups, and one of our there was a tremendous nurse educator actually on asthma in the state of Utah where I'm from, and they were tracking patients that were able to get care through telehealth, tracking their asthma and how controlled and better managed it was versus not. And what they found in the rural communities is it was better managed when they were able to do telehealth. And the crazy thing is, as we were coming out of the pandemic, I actually went with this group to Washington, D.C. to petition our senator, because what they were trying to do is at that time was they're saying, well, COVID's over. We're cutting reimbursement to all the telehealth. We're going to basically reduce your access through telehealth. And we met with Senator Mitt Romney's office in particular, and they did not care about the data. They truly, we're there with a group who had done a remarkable study on how that access improved the care. And they're like, yeah, we don't care. They're going to slash, your reimbursement rates.
yeah, I remember
And
that when they rolled it back. I remember that.
yeah,
Yeah,
yeah. But it goes to show, I mean, even though as an asthmatic, it goes to show with your mission that how important your mission is with education, your mission with the outreach, and also those that are trying to uh, break down some of these barriers that are put in front of us to just get people better access to care, because it's a big deal.
yeah,
So
and that's why
I
we
applaud your work.
Yeah, no, I appreciate it. And that's why we thought of that role because we've got the technology and we've got the nurses. It's just a matter of really giving them that knowledge and putting them in a position where they can actually be that bridge. Especially,
Yeah.
I know many private, I know large institutions have the money and the budget to hire nurses because nurses are expensive. I don't deny that. But for private providers, it becomes challenging to hire a full time nurse. And if one nurse could be shared within a region or within a particular
Right.
county, et cetera, by several allergists or providers, that would potentially be affordable to the provider and at the same time serve the patients and hopefully alleviate some of the burden on the physician so they could see patients faster, see them faster in terms of getting appointments without waiting 3 to 6 months and getting
Right.
access to that care in a timely fashion. So anything we can do to work together, I'm always up for it. So it seems like we do
I
similar things already.
No, I would love that. In fact, as you were just saying that, I was thinking, because I see with telehealth now, we see patients in, I lose track of the number, like 30, 40 states, but to be able to have access, but we just have like my nurse on my team, but it would be tremendous to work to collaborate with your team to where we're now including that nursing infrastructure in the various states, right? That
Yeah,
we're working with. And that would allow me, actually, to your point, to see more patients, to deliver more care, because we've created models where we can now deliver food allergy treatment, remotely through the use of technology. and through the use of those types of service, nursing services. And so I'm
Yeah.
literally want to speak to you after this to see, like, I think there's a tremendous opportunity for us to collaborate and work and to use that infrastructure of the nursing system that you have, that top-notch education that you're putting forward, and combine with kind of what we're doing, in terms of trying to get the actual treatment plans in place. But we need help with some of those execution of the plans. So
Yeah, that'd be a great
that'd be,
pilot, I think, because like I said, we
yeah,
actually just had was the in November, our team had pitched at one of the pitchathons this exact idea of the allergy nurse educator to get funding, so that I know
yeah,
we didn't win this time, but it's something that we're pursuing because we want to get funded to do this kind of work. So at least the pilot and see what ROI is and whether it's really the efficacy of it. And it sounds like you're kind of doing this informally, and I know a number of people who are doing it
yes,
informally, but they're not collecting
yes,
data in order to support this uh, in terms of getting that funding. And we do know a lot of times you need that data. And even if when you have data, as you know, sometimes it still is not being
right,
supported, like what we saw with this Mitt Romney situation that you were talking about, with the
right.
rolling back the funding. So, but data does help. So if we can do something and collect data and kind of show the efficacy of this role, that would be tremendous, I think. So,
No, it sounds like we need to put our heads together and work together to revisit this. And I'm also the president of a nonprofit organization, the Food Allergy Support Team, which is a 501c3 as well, where we work to further the education of doctors and their teams. And even if those two organizations could potentially collaborate, that maybe that gives us the leverage to really pilot a tremendous program to
yeah,
get better outreach for patients.
I'm all
So
about
I
finding
like it.
synergies. Yeah, if we can, you
So
know,
am I. We're
yeah.
we're better together, right?
Exactly. At the end of the day, it's about the patient because I have a
It is.
personal and professional passion for it because like I said, my one of my kids still has food allergies. They were longtime patients at Mount Sinai at the time when doing all these clinical
Mhm.
trials, so they've been sort of the um, always on the cutting edge and trying to figure out how can we cure it. But until we have, and ultimately my goal is that our Food Allergy Nursing Association at some point has to be dissolved because we eradicated food allergies. That's ultimate goal. Hopefully one day, maybe in our lifetime. I don't
Yeah,
know, but I hope so.
exactly. That would be fantastic if we were able to do all of it. And I love very much that you say that, because it seems like sometimes people want to be very defined by their food allergy instead of them defining it.
Hmm.
And that simple mindset of, hopefully at some point we've done our job so well this is gone, says to me, you're not letting it define you in your life, but you're trying to define this
Yeah,
and take that proactive approach in creating real solutions. So that's admirable.
we got to be
um
optimistic, especially with all the research we're having nowadays and all the funding and AI,
tons.
because I really do think with the capabilities we have today and computing power we have today, I think we can definitely conduct research and bring about change much faster than we used to. And if you
Yeah,
remember, like
agreed.
back in the day, it takes like 10, 15 years to implement new research into practice. So now
Right.
all of that is much more expedited than ever before. So I really do think that technology will help us get there. It's just I know it's still kind of new, but we are, I think, moving along in the positive direction.
That's great.
Yeah.
What are some of the biggest, I guess, challenges or pain points that you see nurses face within your organization?
Within my organization, well, it's within our organization. It's not so much within organization. I'd say it's mostly like nursing in general. Number one, it's important for nurses to know we exist because if they don't know we're here to support them and give them all this information, clearly they're not benefiting. So that's one of the things that one of the challenges, I guess, is getting the word out, raising awareness that this resource is available to nurses across the world. Basically, whether you work in allergy care or if you work in hospital inpatient unit, whether you work in ambulatory care setting, whether you work in school setting, community, public health, there's something for everyone within our organization because we cover, even though we're focused on food allergies, we do cover all of the other related comorbidities, whether it be asthma, eczema, EOE, FPIES, you name it. So we talk about all of those conditions. So this way, our nurses are well versed on all different IG and non-IG related allergies. Of
That's
course,
tremendous.
yeah, we've brought speakers in the past, who would, it's really a very diverse landscape of individuals that join us. We've got registered dietitians like Dr. Karina Venter joined us in the past. We've got Dr. Anna Novak join us. We've had um, people from Ruchi Gupta's team join us. We've had nurses, of course, allergists, um, talk about alpha gal just over the summer. I know this year we're going to be hopefully working more on um, school health and bringing more education geared towards school nurses. And I think for school
Hmm.
nurses, they're very specific asks. So we want to be able to meet those asks. So over the summer, we have a couple of sessions planned to help school nurses before the beginning of the school year. We do also have patient perspectives. We want to make sure we include patient perspective. So in May, we're going to have several patients or caregivers come in and talk to nurses about their lived experience and how they turn advocates for themselves and their families. And that Leanne Metalbaum is one of them, Thomas Silvera, who's lost a son in New York daycare, and then also Kyle Dine, who is originally from Canada, turned a musician and an advocate and a business entrepreneur in that allergy space. So we want to bring those stories to life so nurses can learn from them as well. And we have another event actually coming up this Wednesday, and that's our first in-person event at the New York Academy of Medicine, where I chair the nursing section, which is now probably one of the largest sections of the academy. And together with Food Allergy Research and Education, we will be screening a film which FAIR recently released. Well, it's not publicly available, but it's been released, I believe, a couple of months ago. And so that's really to showcasing patient stories and struggles. So we as clinicians and providers could be better equipped in caring for those individuals and advocating for their needs. So that's coming up on Wednesday, February 11th at the New York Academy of Medicine. And anybody who's listening to you who is um, in close proximity, they're welcome to join us. I know the space is limited, but if there's still spots, they can register.
Oh, that's amazing. Awesome. Great. What are kind of your hopes over the next year?
Well, over the next year, now that I have you, so definitely you and I will connect. Maybe we'll have some time at the Quad AI
Uh,
meeting to chat
yes.
further. We are going to have a
Nice.
booth there, actually. So,
So will we.
maybe, oh, wonderful. So we can connect.
Yeah. Yeah.
We also are, like I said, we're excited about the book that's coming out later this year for food allergy nursing. So
Hmm.
this way, nurses have some type of reference that they can use. We also have more exciting speakers coming in the upcoming months, including yourself. And then we are really excited about building that food allergy nurse educator role and truly trying to establish this food allergy subspecialty because in nursing we don't have allergy specialty. We have diabetes nurse educator role, for example, which has been uh, a very successful, very much needed role to manage diabetes, which is a chronic condition similar to food allergies. And so if we can follow this model and do that for our um, uh, allergic patient population, that would be ideal because again, it's a condition they live with for usually rest of their lives. Of course, now hopefully it's going to be with all of the new biologics and early introduction. Hopefully that will scale back some of the numbers that we're seeing that's been on the rise in the last 20 years. But let's hope that's going to be coming down. And that's our short-term and long-term goal at this point, is really trying to get this roll out, and so we can better support our patients.
That's awesome. One thing I've uh, been amazed with over the last few years in working so much in food allergy is there's a tremendous amount of information, but there's probably far more misinformation, that comes out, and misunderstanding that surrounds food allergy, which is where I'm so excited about your group, because you're going to dedicate, great education to nurses and the community. What, just as we kind of wrap up and close today, I always like to leave the audience with, instead of pearls, it's we call it the immune edits. Like, what are the edits that people can kind of change, or perhaps view things differently? When you think about the Food Allergy Nursing Association, the education that you're doing, perhaps even with misconceptions or myths that you're trying to work with, with the nurses, what do you think in terms of whether it's nurses or parents? What are some of those key 2 to 3 edits that they could make, moving forward, so that we're not trapped in misinformation?
You know what? Misinformation is a huge problem. I know that um, it impacts not just patients, but also us as professionals. Because nowadays it's
Hmm.
very hard sometimes to discern myth from facts. And couple that with the political divide on different things going on today. So we have to be extra cautious, and I think extra diligent in what we say, what we produce and publish, and it goes for us as professionals as well as for patients. And so I always say we have this proverb, and I don't know if it's in English or if it translates exactly the same, but measure 10 times before you cut it once. So
Yeah.
is there a proverb in English like that too?
Similar. I think surgeons use it too.
Okay, yeah. So, but
Yeah.
anyway, so in essence, what it says, really verify
Yeah.
multiple times before you put it out into the world. And
Yeah.
so, just the sea of information that we see, and I'm so excited to see more allergists on social media. I know we don't have enough nurses on social media to do this kind of work, and I'm excited to at least see physicians and allergists doing that. So people could follow and could, get that evidence-based information from credible sources. And so if we can have more nurses out there who are also helping amplify that effort, I think that would be fantastic for professionals
Yeah.
and for the patients. And finally, I think my last edit, I would say, is don't shy away from being involved, because a lot of people feel like they clock in, clock out, and that's the end of it. I always feel like, spend extra 10 minutes, get involved in something that you feel passionate about, whether it's the nonprofit, whether it's your professional organization like the Food Allergy Nursing Association, or your nonprofit, Doug, or maybe it's fair, or maybe it's something else, or maybe it's even your own community, like your place of worship, whatever it might be. Get involved, and just, that, I think giving back and being able to make a difference brings so many benefits to personally, for personal fulfillment, but also for community building and for community fulfillment. So I always encourage people to kind of step out a little bit and be able to give back in some capacity. So
I really love that. Just getting involved, just doing something. So many times we see, I think perfection, or the idea of perfection, gets in the way too many times, where it's okay if it's not perfect. It's okay if we, need to pivot, and if we need to continue to learn and change. We learn a lot by doing, but we have to do, and it's crazy because I was just thinking back to 12, 13, 14 years ago when I started doing food allergy treatment, and so many times people were like, well, it's not a cure. Well, it's not a cure. And say, right, but we got to do this and start doing things to get to that space and get to that place. And just because something's not a cure, it doesn't necessarily mean we withhold it. Meaning, we don't need to not do something because it's not perfect. We do the
Yeah.
best we can with what we have, and then we learn through that process. And I'm so glad, 15 years later, we're still not doing nothing because we're trying to get the perfect cure.
Hmm.
And I love that whole concept of just get involved, just do something small,
Yeah.
no matter what aspect it is of your life. So, well, I've
Yeah.
really enjoyed our conversation today. Thank you for taking some time, and look forward to our upcoming conversations and the work that potentially we can collaborate and with and do together. So,
Yeah.
thank you for your dedication to really truly making an impact in areas that is so desperately needed, and really admire your work. So thank you.
Thank you so much for having me. I appreciate it.
Yeah. Thank you so much again for tuning in. We'll see you next time on The Immune Edit. This show is separate from my clinical practice at Global Allergy Immune Network. This show represents my opinions and my guests' opinions. Neither myself nor the show endorses the views or statements of my guests. This show is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. This show is provided with the understanding that it does not constitute medical or other professional advice or services. If you're looking for help in your journey, please seek out a qualified medical practitioner. It's important to have someone in your corner who is a trained and licensed healthcare practitioner who can help you make changes, especially when it comes to your health.